And to the latest on the status of COVID now, the province released new modeling today, again giving us a best worst case scenario. While there are some positive signs, the warning is it could still go either way.
It is best described as a fragile or precarious situation where we need to make sure that cases continue to flatten and decline.
So the best case scenario is if Ontario stays at the current level of provincial growth, which is around 1%, it would continue to see around 1,500 cases a day through December. The worst case scenario, we go back to the 5% growth from 2 weeks ago, and then we would see 9,000 cases a day. Regionally, Peel has the highest positivity rate at 10.4%. Toronto's is 5.6%. While cases in regions outside those two lockdown zones are growing. The Chief Medical Officer of Health said he is not recommending any other areas go into lockdown.
The encouraging part is that we're seeing these things potentially turning, and no one more than I would like to see it even moving more aggressively down.
Now, there is still great concern for hospital capacity. Hospitalizations have increased by 63% in the past 4 weeks. And under any scenario, ICU beds will hit 200 in Ontario, which puts surgeries in jeopardy. Long-term care is flattening, but resident deaths have increased, with 64 in the past week. And one startling fact from today, 70% of Toronto's cases have no epidemiological link, which means they cannot be traced. That is significantly higher than Peel, for example, which is at 27%. And the Ford government today acknowledged the risk of COVID in schools is greater in red and grey regions, and it's going to start voluntary testings of students in those schools. This is significant. It will give the first real snapshot of the level of COVID in schools.
We're launching voluntary testing for asymptomatic students in regions of the province which currently have a high number of active COVID-19 cases. This includes Toronto, Peel, York, and Ottawa.
Earlier this week, City News broke the data down and found 48% of schools in Brampton had at least one active COVID case. In Toronto public schools, that number was 30%, while in Toronto Catholic schools, it was 35%. High-risk schools will be tested first. Students will either be given the nasal swab or a saliva test, and a mobile unit will go to the school or into the community.